Jefferson County Health Officer, Dr. Mark Wilson, joins us tonight to talk more about the impact of the virus here. Thank you so much for joining us this evening.
Thank you.
Hearing those numbers, do you think the virus impact in terms of spread and death, frankly, is slowing in Jefferson County?
We don't really have evidence of that at this point. You have to keep in mind that there's some lag time in getting some test results in, especially over a weekend. So looking at it just from one day to the next is not terribly helpful. I will say that we've had more cases in this past week than we had the week before that, about a 30% increase. Now, some of that is because we are doing more testing, and that's a good thing. So what we're really looking at is hospitalizations, and so far hospitalizations have been up in the last couple of weeks just slightly, but mostly plateaued over the last 6 weeks or so. But that's one of the crucial numbers we're keeping an eye on, is hospitalizations and certainly deaths.
You mentioned that testing in the county. We've had more testing. We've reported over the last week different places you can go in the county to get tested. Do we have enough testing in the county?
Right now, we are doing quite well in that respect. A lot of the places that are offering testing are able to do more than they're doing currently. We've been staying in regular contact with the major providers of testing in the community, and they say they can do plenty more. So one of our biggest messages to the people in the community right now is to get tested. If you have symptoms or you think you might have been exposed, certainly. But now we're starting to say that we would like people who have no symptoms to be tested, especially those who work in areas or spend time in areas where they're in contact with a lot of other people. So places like shelters, group homes, those congregate living situations, but also people in the workforce, like our grocery store workers, restaurant workers, others that are in frequent contact with the public. We would encourage them to go ahead and get tested at one of the many sites that are available, and that information is available on our health department website.
You also mentioned hospitalization and deaths, two things that you tend to pay attention to. Is an excess deaths number something that is looked at? Because we know that the government typically keeps a number of typical deaths per day.
Well, I mean, I'm not sure I understand your question. I mean, we're looking at the numbers of deaths related to COVID-19 specifically.
Versus this day last year, if you know you have
overall deaths.
Yes.
Well, I mean, yeah, I have not looked at that number recently. You know, some things are down. We are concerned about other health conditions and people not having had access to regular health care because of COVID-19. So I know that's a big concern for our healthcare system overall, is sort of the side effects of this, if you will. Our healthcare institutions and our doctors' offices and our clinics here at the health department are still limited by the lack of protective personal equipment for us to conduct our clinical operations. So that is a big concern, just access to care for other things.
All right, sorry for the confusion there in the question. Dr. Wilson, thank you so much for giving us some time tonight.
Thank you.